Hello, guys. Hope you're all doing good.
Hi, ma'am.
Hello, ma'am.
How are you?
Hello, good afternoon.
Hello, ma'am.
Hi, good afternoon.
Hello, ma'am. How are you?
Hi, good. Thank you, Hepzibah. How are you? Long time.
I'm fine, ma'am. Thank you.
Hi, ma'am. Good afternoon.
Good afternoon. Good evening. Hello. Oh my God, I missed you so much. Hi, Ayaz. Hello.
ma'am. How
Hi, good. How are you?
Good, thank you.
Hope you're all doing
Ma'am, good
Hi,
evening.
Sima. Long time.
Good evening, ma'am.
Good evening.
Good afternoon,
Good
ma'am.
evening, ma'am.
Good evening. Yeah. So, yes, happy to see you too, dear. Yes. Hello, dear. Hi, Oprisia. Hi, Sagadip. Welcome to Elite Expertise. Yeah. Let's start. So, yes, the July exam has seen surprises because the exam was more concept oriented rather than, more recall based. So we've done very good more than 300 hours of concept-based classes in the previous batches. So today we are bang on with the new sessions for the batch rate. So this is officially the first class of us starting the concepts. So basics of pharmacology, autonomic nervous system, and we'll go from there. So we'll make it as much practical as possible. So there are changes to the methodology we teach in, and it would be more practice-based, concept-based. This is what APC expects you to learn and to be able to practice as a Australian pharmacist and as an independent Australian pharmacist. So, well, let's start our session today. So for those who don't know me, I'm Harika.B, a practicing pharmacist in Australia. I'm also an accredited consultant pharmacist, accredited by Australian Association of Consultant Pharmacy. I work as a clinical pharmacist and a clinical pharmacist educator at Monash Health Hospital in Melbourne. So Monash is not a university, it's also a hospital. So I work there as a clinical pharmacist and clinical pharmacist educator. And I've been teaching students, interns, in helping clearing oral exam, written exam, and KAPS exam, which is knowledge assessment of pharmaceutical sciences, which enables us an overseas pharmacist to practice in Australia. So today we will start with the first session. I hope the same old my signature line. I hope all of you can see me, hear me, and see the slide. All good?
Yes, ma'am.
Okay. So we'll start with basic pharmacology for KAPS, again, which is knowledge assessment of pharmaceutical sciences. So let's make it interesting. Let's make knowledge acquiring more interesting, more concept oriented, so that we enjoy what we study and we apply in our practice. So in a meaningful way, because whatever we learn, it has to be useful for someone, for you, for mankind. And that is what pharmacology is all about, pharmacy is all about, and pharmacist is all about. As an Australian pharmacist, they expect you to constantly strive for patient health and well-being, which is the first priority for a pharmacist. So, yes, first point is the code of ethics of an Australian pharmacist, which an Australian pharmacist should know and implement and practice the values in their real life practices is professionalism, following the ethical principles of the profession, and working constantly and striving for excellence, where patient safety and well-being is your first priority. So whatever you do in your practice, you're directly or indirectly affecting your patients. Okay, patients are not just consumers who like bind you financially, but patients are more ethically binding to you. Okay, so whatever you do, whatever you say, whatever knowledge you share, or like whatever advice you give to any patient for any question, make sure it is 100% accurate. At least try to be as accurate as possible, and try to enhance your knowledge from time to time, because you're directly affecting the health and well-being of the patient. And as a pharmacist, patient safety and well-being is your first priority. You rather say, I don't know, I'll refer to my guidelines and I'll let you know, than showing up your knowledge and answering a question which you don't know, which you're not appropriate to answer, and then putting the patient's safety and well-being, health in risk. Okay, so you would rather be a knowledge-seeking pharmacist, okay, rather than a pharmacist who has immense knowledge, yes, which is good, but who cannot guarantee the accuracy, because your advice is taken as a precious thing, like patient follows it directly. Okay, so you're affecting a patient's health and well-being. So as a pharmacist, patient safety and well-being is your first priority, and that is mentioned in the regulators always, always, even in your preparation, even in your practice, even in your future. Always think about patient, consider the patient first. It's not only advantages to the patient, it is advantages to you as well, because when you think about the patient and you consider the patient as a first priority to you, you never go wrong. Okay, so never think about the disease, or like, yes, you do think about the disease symptoms. Yes, I'm not saying never, I'm sorry, I'm not saying never ever think about, but the first priority for you to solve any problem should be patient. Okay, I know a friend of mine who is a GP. She's a doctor, and once we had our professional discussion with each other, like, how doctors treat patients and how pharmacists recommend medications. And she said, in differential diagnosis or treating the patient, a doctor thinks from head to toe. Okay, so if a patient is suffering with any problem, okay, with any health issue, suppose pain, or suppose if he has a fever, okay, then a doctor thinks from head to toe. Maybe if you go to the head, maybe the patient has hit something to his head, okay, or if you go to the nose, he has inhaled some toxic material which is causing fever, okay, or ears, lips, mouth, okay, respiration, and then heart and other organs. So a doctor comprehensively thinks about patient from head to toe in diagnosing. A pharmacist advises, and his knowledge is more pharmacological point of view. He treats the elements by suggesting the best remedies, and he also advises the doctor. We are proud to be pharmacists, like practicing in Australia, where we directly deal with doctors and patients. We act as an interface between a doctor and patient, and um, we make sure that safe and effective medications and management, therapeutic management, disease management is available to the patient at all times. Okay, so this is an example of how a doctor thinks from head to toe. In the same way, whatever you think as a pharmacist should surround around the patient. Okay, so if you have a patient smiling, so it should be around the patient. Whatever you do, whatever you think, whatever decision you make, surrounding the patient, radiating the patient, like thinking about the goodwill. I mean, like, not just about goodwill between you and patient, but about complete patient care, okay, in different angles. But it should not be just drug based, like as all pharmacists do. We are drugs. I mean, like, we deal with drugs, not we are drugs. We are druggists. We deal with drugs. But if you think about the patient in a comprehensive manner, you never go wrong. And the same principle applies in your examination as well. If you think about the patient, always imagine there is a patient, there is a human being there whose precious life is involved, and then take decisions. Then you never go wrong in your exam. So that's a major tip, a takeaway point. If you think about patient, you will never go wrong. Okay. So let's start with a case study. So before like introducing you to the subject, I want you to know how you can apply your knowledge into practice and how you can change lives, how you can help people. So this is a case study in front of you. Just give 2 minutes time, go through the case study, and I will discuss this with you now. So there is your friend, paralysis. Okay. So Bindu says it's paralysis. Okay, let me talk about the case first, and then we can discuss about the therapy. So I hope you all can see this. Okay, hypertension, says Pradeep. Okay, so there it is a mid afternoon, and your neighbor, you have a friend who's your neighbor, and you work. Yes, okay, snake bite. Okay, so let me tell. Okay, so it's mid afternoon, and you have a neighbor who's your friend. You're a pharmacist working in an emergency department, and then your neighbor brings 25-year-old James with him to the hospital. If you look at him, his gait is unsteady. What do you mean by gait is unsteady? Can anyone tell?
His walk is not proper.
Yes, his walk is not proper. He's a bit fiddly. You can see there's something wrong with him. His position is not appropriate. His gait yeah, not able to stand properly. In layman terms, in normal human being terms, yes, improper movement, unable to stand properly. He's unsteady. Yes. So what normally for gait becoming unsteady, what could be the reasons normally? Like, just you don't have to be an expert in pharmacology. Just think like a normal human being and tell if a patient's gait is unsteady. What? Yes, you can answer the question actually, Prashant. Yes, good job. Vertigo, feeling dizzy can be one of the reasons. Vertigo, which is Meniere's disease, imbalance in your ears, can
Maybe
be.
less glucose levels.
Yes, hypoglycemia,
Yeah.
less glucose levels can be one of the reasons. Yes, alcohol. Yes, alcohol can be one of the reasons. Like an alcoholic patient is a bit dizzy, his gait is unsteady. Low blood pressure. Yes, poison can also be one of the reasons. Nerves damage. Yes, it can also be one of the reasons. Good job, Madhuri. Anu, yeah, Parkinsonism, yes, kind of, yeah, if you think deeply. Patient, okay, um, okay, uh, and anything else? Any low blood sugar
Organophosphate.
levels? Yes, I'm not talking about the answer. I'm talking about patient's gait becoming unsteady. So there could be many possible reasons. Okay, so blood pressure, blood sugar levels. He's tired. Maybe his diet is wrong. He didn't eat properly. Uh, okay, those are all trauma. Yes, I mean, like if you go deeper, there can be multiple reasons. Yes. So he's walking with the support. Definitely, he's taking the support of his friend who is your neighbor. Okay. So he presented to the emergency department. That means there should be something wrong. Okay, definitely. Um, he has difficulty speaking. Why will anyone have this difficulty speaking? Can anyone tell what could be the reasons? Just think about the difficulty speaking and think about any possible reasons which can lead to difficulties. Yes, stroke is one of the reasons. Yes, which can cause difficulty speaking. Yes, time out. Yes, flood.
Paralysis.
Yes, paralysis. Yes, stroke, paralysis. Yeah, myasthenia gravis. Yes, shortness of breath. Yes, definitely. It can cause difficulty in speaking. Anything else? Brain damage. Yes, the coordination, communication isn't proper, which is causing difficulty speaking. Yes, it could be one of the reasons. Anything else? Asthma,
Oxygen, less
injury,
oxygen
aging.
supply.
Aging, yes, definitely. Hypoxia, less oxygen.
Yeah.
Yes. Nerve damage. Yes. Transient ischemic attack. Yes. Yeah. If you go deeper, you have a lot of diseases coming out. Yes. So the basic thing is, like as you said, stroke can be one of the reasons. Sore throat. Yes. If you go in a very generic way from basic, if someone has sore throat, they can't speak well. Yeah, low sodium. Okay. Yes, can happen. Yes, definitely, it's correct. But you're very thinking a bit deeper. Yes, mouth swelling. Maybe someone has hit his mouth. He can't speak well. So from a basic thing like sore throat to a range of diseases which affect the central nervous system, there could be many reasons for a patient to have difficulty speaking. Okay. What about difficulty in swallowing? When can a patient have difficulty in swallowing? Yes, dysphagia is a term which we use. Yes. Anyone else? Good job, Bindu. Throat infection. Yes, definitely. If you think about a basic tonsillitis, throat swelling up, tonsillitis. Yes, they can have difficulty in swallowing, speaking. If some muscular damage happens, pharyngeal muscles, then it can happen difficulty in swallowing. From basic things like sore throat to advanced diseases which affect the central nervous system and the coordinating, communicating center of your body. So let's talk in layman languages, in a normal human being language, because we are all starting from basics. Yes, it could be, yes, Bindu, thyroidectomy can be a possible reason. Yes, so these are the possible reasons which can cause difficulty in swallowing. So his vision is blurred. What are the possible causes for a blurred vision?
Hypodiabetic neuropathy,
Okay, myasthenia gravis, stroke, then
retinopathy,
retinopathy is like an advanced, yeah, it's like really advanced. But you can think from always think from basics until eye infection. Definitely, if you think about the basic thing, high BP, excellent, Pradeep. High BP can cause blurriness of vision.
hypoglycemia as well.
Hypoglycemia, glaucoma, migraine, cataract, excellent. Migraine can cause blurred vision, especially ocular migraines, vertigo, conjunctivitis. From a simple eye infection or something falling into your eye to all these advanced diseases you're talking about, like retinopathy, diabetes. High blood pressure is one of the reasons for blurring of vision, which can happen, or even low blood pressure can also cause blurring of vision. So yes, so there could be so many possible reasons for difficulty speaking, difficulty in swallowing, vision being blurred, and gait is unsteady. Is walking with support. Definitely, he needs support. And his eyes are filled with tears. Okay, and yes, okay. So his eyes are filled with tears, and he's continue. So his basically that point indicates what? Eyes filled with tears. Allergy, yes, it could be one of the possible reasons for eyes filled with tears. Irritation can happen. Maybe he's like, yes, yeah, he's in severe pain and that's why he's crying. Yes, like a normal human being, like if someone is not feeling well, they cry. So this can happen. His eyes are filled with tears. Yes, okay. Yeah, dry eyes can be one of the reasons for a teary. I mean, like dry eyes, okay, maybe possible, but it's like not sleeping properly. Very good. In a generic way, yes, or in an organic way, yeah. So a patient has not slept well, and he has teary eyes, maybe some conjunctivitis or dry eyes, or or allergy in the eyes, sinusitis, etc., etc. So these are the normal things which we think. Cold can be one of the reasons, yes. So a neighbor. So yes, if you think about in this scenario, if you're thinking about just the symptoms, okay, like difficulty speaking, okay, difficulty swallowing, blurred vision, eyes filled with tears, unsteady gait. So what are the reasons we have seen? I mean, like, what are the symptoms we have seen? We have seen difficulty speaking, difficulty swallowing, we have seen blurred vision, we have seen teary eyes, we have seen gait being unsteady. So if you're thinking about just the symptoms, okay, your thinking will be very narrow. Okay, like the disease management or the diagnosis. Basically, we are not involved in diagnosis as pharmacists. We recommend the therapy, but yeah, if good job, Sagadi. So if we are thinking about the symptoms, and our thinking is always narrow, we are thinking about difficulty speaking, difficulty swallowing, difficulty blurred vision, teary eyes, okay, and gait being unsteady. So we have seen maybe he has low blood pressure, low blood sugars, dysphagia, allergy in his eyes, or he's not feeling well, he's sleepy, or he didn't sleep well, that's why he's crying, etc., etc. But if you think about the patient, James is a 25-year-old patient, and he presented to the emergency department and he's not feeling well. He's unable to stand properly, unable to balance himself. He needs support. He has difficulty speaking, difficulty swallowing. His vision is blurred. His eyes are filled with tears. And if you see the history, he's working somewhere where vegetables are being picked. Okay, so continue picking vegetables. So what could be the possible reason for his admission? How serious?
Poisoning.
Poisoning. Why poisoning can happen? I mean, like how in this case poisoning can happen? Snake bite, do you think? Okay.
Insecticides may be used on
B.
vegetables like
Insecticides.
Yes. Yes. Maybe yes, that's the thing.
B. Bites.
Yes. Yeah. Good job. Yeah. So this is what you do in history taking, okay, which is very important when you do your intern exams. So basically, what's the occupation is also related to the disease, because there are some diseases which are related to occupation, like asbestosis. Someone who works where asbestos, they deal with asbestos. They get asbestosis, respiratory diseases. So occupational, occupational diseases can happen. So this is what you do in history taking. You check the age, you check the gender, you check the symptoms. Definitely, that's also important. And you check the patient, you check his history, you check his occupation, what's happening, what is his problem, and always try to help the patient. Okay, treat the patient, and automatically you can follow treating the symptoms. So here he was working in a vegetable, like somewhere where vegetables are there, and maybe he's picking the vegetables like a vegetable farm. And what happened to him is maybe he could have accidentally ingested a pesticide, okay, inhalation pesticide or something which has happened. And that could have caused this, which could be a serious case of poisoning. So we all talked about low blood sugar, low blood pressure, we talked about allergy, etc., etc. But a simple case like this could be a serious case of poisoning. That is why you dig a bit further. You always never assume what's happening based on very little information. You try to get best possible history all the time, okay? Because there could be something serious which is hiding, okay? So definitely in this scenario, if you go a bit further, these are the points you dig. And when you talk to your friend, your neighbor, that he says that James is working in a field, in a vegetable field, where they're spraying pesticides early in the morning with a material which has odor of a sulfur-like smell, okay? And within 3 hours after starting his work, this you would know when you dig a bit further, when you try to know the comprehensive patient history. So James, in the morning he woke up, he was fine, nothing happened. And look at his age, he's a 25-year-old young man. He works in a farm where they spray something which smells like sulfur. Within 3 hours of starting his work, he has complained of tightness in the chest, okay? So he's unable to breathe. And he called for help before becoming disoriented. And definitely your neighbor has gone there and took James to the hospital where you are there, and you're trying to help him as well. So how would you proceed to evaluate and treat James? And what should you be doing to help him? So it's open for discussion. Like, I want all of you to speak out and participate in this interaction. So what would you do to help him? Remember, think about the patient. Patient health, safety, well-being is your first priority. So how would you help him? Bring his vitals normal. Excellent. Vitals are vital. Vital signs. What are vitals, Alan? Can you speak out? Blood pressure. Yes. Blood pressure,
Find out,
oxygen. Yes. Sorry.
finding what
Glucose
poisoning.
supplement and We can
Temporary.
give activated charcoal
substance and,
before.
giving the antidote.
Yes, finding the poison, giving the antidote. But even before like finding the poison and thinking about antidotes, you first give support to the patient. Okay. Yes, you give activated charcoal in case of poisoning, the toxicology principles you apply to prevent the spreading of
Can give
poison.
dextrose maybe.
Okay. So the main vital things is blood pressure, temperature, blood sugar levels, fluid balance, pulse rate. So you support the patient first. You see what's going wrong and you give support to the patient. Don't think about the poison. First thing you do is you think about the patient and then think about the poison. Support the patient and the patient will start fighting for his life. Okay, when you support him, definitely it's like supporting his respiration by giving oxygen if he's having difficulty breathing. And so you're doing what is supporting the patient so that he can fight to survive. And then you think about the poison and prevent the spreading of poison by giving an antidote. The most common antidote is activated charcoal. And then, yes, if he has a cardiac arrest, you give CPR. Definitely, that's the first thing you do. And good job, Nikita. So you're thinking about the patient, then think about the poison, treat, supportive care, think what's wrong, and then treat the patient. So here, definitely, what kind of vital support do you give James at the moment?
Oxygen.
Oxygen, yes. I mean, breathing support, yes. Respiratory support, oxygen support. Because he has a complication of tightness in the chest, which has made his breathing very difficult. So you give at first, you monitor his blood pressure, okay, and give supportive care. And what could be the possible reason for this happening? Like the poison. Anyone? I mean, like all of you should be knowing this, I think.
Anticholinergics.
Organophosphate poisons, the pesticides, organophosphates, are the main responsible factor for James' condition.
Atropine, ma'am.
Yes, good job. So what happened to James? He exposed himself to organophosphates by working in a vegetable farm where pesticides are sprayed on vegetables, and he might have accidentally inhaled the poison, which has created this effects of unsteady gait, difficulty walking, difficulty speaking, difficulty swallowing, blurred vision, eyes with tears. And sorry, please mute your microphones when discussion is over, please. And then tightness in chest, which is like worst symptom. He's having a difficulty breathing, so you have to give him a respiratory support. Okay. So this is an example of organophosphate poisoning, and this is how you as pharmacists can help in saving the life of the patient. So what is the antidote for organophosphate poisoning? I don't expect,
Atropine.
but yeah, if you know, it's great. I will teach you everything in detail later. So atropine is a life-saving medication, which is an antidote in organophosphate poisoning. If someone exposes themselves to pesticide poisoning, atropine is given as an antidote. So here, apart from giving preliminarily giving respiratory support, symptomatic support, and then monitoring his blood pressure, his vital signs, and then preventing the spread of poison by giving activated charcoal, you also give him an antidote, which is atropine, which is a life-saving drug in organophosphate poisoning. All the doubts, we'll do it at the end. Sorry, Bharat. So that's an example of James, and this is how you helped him. So basically, what happens in an organophosphate poisoning is organophosphates are related to acetylcholine. They are acetylcholine-like chemicals, and when their concentrations increase in our body, we get muscarinic effects. We will talk about muscarinic effects in detail in the next class, but basically the symptoms of having an organophosphate poisoning or like going through an organophosphate poisoning situation is the patient will involuntarily urinate, involuntarily salivate, lacrimate, and maybe vomit could happen, and diarrhea could happen, which can happen involuntarily. So here, James was crying. He was not crying with pain, or he was not crying because of lack of sleep, but he was crying because of organophosphate poisoning. So your secretions increase. Yes, the cholinergic symptoms. Good job, Prashant. So the secretions increase. Okay, then you are, Farhan, please mute your microphone.
Ma'am, I just want to say something else.
Yes.
Ma'am, as the organophosphate or the acetylcholine esterase inhibitor, so all over the body there is a cholinergic thrush. So, like the symptoms you said, like urination, lacrimation, salivation appears so fast. So, I just want to ask, when the patient has that chest tightness, can we ask him to do the sorry. Respiratory, you can say expiratory flow rate. Can we check the respiratory flow rate manually? And can we suggest the hydrocortisone injection and Avil injection on spot for chest spot if the saturation goes down?
Okay, so the symptomatic management should be, it will be
Yeah.
detailed in discussion in the next classes,
Okay.
but we're not going into those concepts today. But definitely the tightness in chest is reversed by giving atropine. Okay, it should be reversed by giving atropine, because here excessive amount of acetylcholine is in his body. So if you counteract that, you are going to give life to the patient. Okay, so this therapy management would be more antidote related, toxicology related. Okay, you don't expect to, like, check the expiratory volume of the patient. Like, you see the symptoms definitely, and you give the treatment based on that, but this is a case of emergency. Okay, so just be mindful of that. Anyways, we'll discuss about everything later. Any doubts, we'll do it at the end, guys. Don't break the flow. So okay, so that's what you helped James. Definitely he was crying, not because of pain or anything else, not because of sleeplessness, but it's because of too much acetylcholine in his body. He's crying. Okay, he's not actually crying, he has tears in his eyes. So what happens in organophosphate poisoning is, if you can see, literally the patient who has consumed poison will salivate excessively. Okay, like if you've seen some movies, okay, if someone has consumed pesticide, they will fall down with hand on their chest, tight chest, they can't breathe properly, and they will involuntarily urinate and salivate. Saliva oozes out from their mouths. Okay, so that is a symptom of organophosphate poisoning. That is because of too much acetylcholine in their body, because of consumption of organophosphate poisoning. And definitely atropine is a superhero which treats the poisoning in case of organophosphate consumption, accidental consumption of organophosphates, which are called in layman languages as pesticides. So we talked about James and we have helped him. Now let's talk about Bruce. Okay, I'll give you 2 minutes. Read the case in detail and we'll have a discussion. Yes, many people are saying it's related to hypertension crisis, hypertensive emergency, etc., etc. We'll go into details of that shortly. Insomnia related, says Abdul. Okay. It could be like, yes, the patient might have got insomnia as well. He's having nocturia. We'll talk about that. Drug overdose can happen, says Nikita. Prostate problems. Okay. Okay, so let's talk about Bruce. So Bruce is a 29-year-old young male. He has presented to emergency department. Obviously, he's presented to emergency department. There's some problem. After being seen in clinic with the BP of 210/150. So where did Bruce go first? Like, when you're thinking about the patient, what is the first presentation Bruce made to? Where did he go first?
Clinic.
Clinic. So in a clinic, in a primary healthcare clinic, they must have seen him. He must have visited for a checkup or something, or he was not feeling well. So he primarily presented to clinic, and there they checked his blood pressure, okay, which is 210 by 150, which is high, isn't it? So that's why the clinic people, the primary health clinic, the GP, local doctor, they must have referred the patient to the emergency department. So his weight is stable, 88 kilos. His height is 193 centimeters. Looks like he's tall. He reports new onset blurry vision for the past 3-4 days. New onset blurry vision. What does this mean?
Recent onset.
Recent, yes. Very recently, Bruce has got blurry vision. What is blurry vision?
They can't see the images clearly.
Yes, they can't see the images clearly. The vision is not clear. So, and then what could be the possible reasons for blurry vision? Thinking like a layman, what could be the possible reasons? You can speak out now. Diabetes,
Blood pressure.
retinopathy,
General ones are low blood pressures and
high blood pressure,
hypoglycemia.
hypoglycemia. Okay.
In-depth, maybe the bleeding conditions also cause blurry visions.
Yes. Okay. Eyesight issues. Basically, that could be one of the reasons. Maybe he has eyesight issues, says Prashant. So, like some patients, they think that they have blurry vision and they go to see an optometrist. Okay, someone who deals with eye, and there they realize that there's something else. Okay, so blurry vision could be just like normal sight related, or it could be underlying disease related as well. So, okay, so you've told the possible reasons for blurry vision. If you break this patient's history into parts, the information you have into parts, you have seen blurry vision, but it is a new onset for last 3 to 4 days. So, any reason for new onset blurry vision?
Is there any other concomitant medications or diseases?
Maybe if he has started any new medications, that could be one of the possible reasons. If something has fallen into his eye, or he has changed something, like, his house has some dust particles, or, he's exposed himself to some place outside or he has done some trekking, or he has gone to traveling and then he got exposed to something, or maybe, like, if you think about just the blurry vision for past 3 to 4 days, or exposure to chemicals, good job, Madhuri, it could have happened, or maybe lack of sleep or drug interaction, says the other student. Okay, so that could be many possible reasons, but it's a new onset blurry vision from past 3 to 4 days. So you would definitely dig a bit further on what changed in the last 3 to 4 days. Okay, and nocturia. What is nocturia?
Increased urination at night time.
Frequent urination.
Frequent urination, especially at night time. So what could be so he's going to toilet 3 to 4 times per night.
Overactive bladder.
It could be overactive bladder. Yes, that could be one of the reasons. Diabetes could be. Yes, good job, Prashant. Diabetes.
Urinary tract infection.
Yes, definitely. Good job, Bindu. So he might have suffered from a urinary tract infection, which could be one of the possible reasons. Has some issue with kidneys. Excellent, Rimpy. This could happen.
Renal dysfunction.
Sorry?
Renal dysfunction.
Renal dysfunction could be one of the possible reasons. So, yeah, so he's going to toilet 3 to 4 times at night. He's getting up and going to toilet.
There is a chance of proteinuria, loss of protein.
Okay, protein in the urine. Okay. So, and this has been happening from 2 weeks. He's going to toilet very often, and his urine is frothy since last 8 months. What is frothy urine?
Thick
When
foamy.
there is a presence of some proteins.
Yes,
Human
urine. What does protein in the urine indicate?
Kidney
kidney damage.
dysfunction.
Ketoacidosis.
Damage. Yes, some damage to the kidney. The urine is frothy, means your kidneys are not filtering things properly, and there is some leakage going into your urine from your kidneys. Okay, so kidneys are basically a structure, an organ which is meant to filter the waste products out. But if your urine is frothy, that means there's some leakage going on. It is pushing some protein into your urine, which could be proteinuria. So does this indicate organ damage?
Yes.
Yes, yeah. This case definitely indicates there is an organ damage. Okay, and since last 8 months, this has been happening. So it sounds a bit fishy. There could be a chance of organ damage. Frothy urine indicates there could be some problem with kidneys.
Proteinuria, kidneys.
Yeah. Yes. He could be gout, say Scorpio. Okay. So he denies edema. What is edema?
Swelling on the like spitting edema type.
Accumulation of fluid in interstitial space.
Yes. He denies edema means there is no swelling in his body. He has no pain. He has no symptoms of nausea and vomiting. Okay, which is good. Okay, he has no symptoms, no swelling, no pain, no nausea, no vomiting. So if you're thinking about symptoms, each symptom specifically, definitely there could be various possible reasons. So Bruce is a 29-year-old male. Now you think about a 29-year-old male going to a clinic and getting his BP checked. And the BP is 210 by 150, which is not normal. And he reports that he has new onset blurry vision. Now you're connecting blood pressure with blurry vision. There could be a greater reason for that. Okay, a strong reason for this happening. And he has nocturia, frequent urination, and that too frothy urine since last 8 months. It could indicate some issue with the kidneys, or it could be a possible chance or serious case of organ damage, which has been happening like in a chronic way. And obviously he's denying any pain, which is good. Edema, nausea, vomiting. Okay, so the blood pressure, normally chronic renal failure, says Bindu, but it could be, yes, definitely could be one of the reasons. So normally, what is a blood pressure a normal human being would have?
140 by 90.
120 by 80.
120 by 80.
80, yes. So systolic over diastolic blood pressure is 120 by 80 mmHg of mercury. That is the normal blood pressure. And when would you consider an elevation of blood pressure? When would you consider a hypertensive emergency?
During
Greater than
rigorous
200.
exercises, also they may increase the blood pressure at the times.
Sorry, during what?
Rigorous exercises,
Rigorous
heavy lifting weights, just
Yeah.
increase for few
Yeah, okay.
minutes or hours, not that
Yeah.
long.
So let me talk about, so I'm not asking, okay, that's good. So I'm not asking about what are the reasons for high blood pressure. Yes, definitely, if we are talking about high blood pressure reasons, improper diet, heavy weight, exercise, or maybe hypertension could just happen because of unknown reasons. Most of the hypertension, most of the blood pressure issues happen because of unknown reasons. A patient could be doing everything right, but still have blood pressure issues. Okay, it could be genetical, it could be of unknown reasons. So when, suppose a patient, if you see Bruce's case, he has been referred to ED when his blood pressure was 210 by 150. So normally, as you all told me just now, is that the normal blood pressure of any human being, like a normal human being, is 120 over 80. When would you send a patient to emergency?
Greater than 150 by the systolic.
When would you treat a patient in a local clinic? When would you send the patient to an emergency department? Or, yeah, okay. Okay, Prashant.
Greater than 180, we'll send it to the emergency department.
Okay. So what, okay, we'll talk about that. But before that, what is blood pressure? So all of we know blood pressure. Definitely, you're all pharmacists. We all know blood pressure. And if you're not
Constriction
pharmacists,
of blood vessels.
sorry.
Constriction of blood vessels causing pressure to blood vessels.
So I'm a normal,
Blood
like
flow.
I'm a layman coming to you. I'm not educated And if I asked you what is blood pressure, how would you explain me?
Blood striking
The
to the
lateral,
wall of blood vessels.
Yes,
the,
definitely. So
Pressure
it,
due to the blood pressure.
yeah. So
the
if you take my blood vessel, I've got my blood flowing in my blood vessel. Okay. And the pressure exerted by the flow of blood onto my walls of blood vessels is nothing but blood pressure. Okay. And all my organs have blood flowing in it. Okay. And that is why we are surviving. Like we have life because of blood, because blood carries oxygen to all parts of the body. So the pressure exerted by blood on your blood vessels, on the walls of your blood vessels, is blood pressure, basically. So what happens if there is too high blood pressure? Just tell me in a simple term. I don't use a medical jargon. Just tell me what happens if there's a high blood pressure.
It pushes the walls, causes pressure on the walls.
Yes.
Pressure on the
What
wall.
Yes, and then
Increase force of blood.
yes,
Kidney damage occurs.
kidney
due to
damage, capillaries rupture, organ damage, headache. Yes, those are the symptoms.
Heart
Sweating,
rate increases.
heart rate increases. Yes, heart attack. Okay, stroke, anxiety, blood vision. Blood vision could be one of the possible consequences.
Increase.
Okay. Okay, Saurabh says load on heart increases, pressure on walls increases. So just imagine a balloon. Okay. If you're pumping air into the balloon, normally it's okay, balloon will inflate. But
Leakage of the blood from the walls.
yes, leakage can happen. But basically what happens is if you're pumping too much air into the balloon, like too much, you're pumping. At a stage where it has reached the saturation, what happens to the balloon if you pump too much?
Blast.
Burst.
Burst. Yes, tough. So that's the sound you get. Balloon breaks. So that is what happens to all our organs. Okay, they break, they burst. Okay, so your kidneys, your brain, anything like that is because of hypertensive crisis. Okay, so where too much blood pressure is called hypertension, and if it is uncontrolled in nature, organs
Leakage of
will
blood.
burst. Just basic thing is bursting of your organs because of too much pressure. What happens if your blood pressure is too low?
The organs doesn't receive sufficient blood.
Yes, yes. If the pressure of the blood is too low, the blood cannot flow properly. And suppose if the blood has to come to your intestines, it has to come to your heart. Even your heart has to get blood supply, though it pumps the blood, you know that. So your brain has to get some blood because through blood they get oxygen and they get they have a chance to survive because after all your cells in your body, tissues are living and they all crave for oxygen. What happens if you have low blood pressure is blood cannot flow. As a result, the tissues, cells, they go into shock, okay, and they fail. So low blood pressure is not good and high blood pressure is also not good. And optimal blood pressure is always important, which is 120/80 is the optimal blood pressure, which we all know about. So Bruce is a 29-year-old male. He has presented to the emergency department with a blood pressure of 210/150. And his weight is stable. Height is 193. He reports new onset blurry vision for the past 3 to 4 days. So if you have blurry vision and if you have high blood pressure, there could be blood vessel damage which is going in your eyes. So it's like all, or as you all said, balloon will burst. In the same way, your optic nerves, your optical retina, all the sides of your eye, they can burst, okay, causing blurry vision. And it can be actually seen in the fundoscopy by optometrists. So there could be some changes to your retina, your eyes. They can physically see that. That is because of too much high blood pressure. And nocturia, that is frequent urination plus frothy urine, could indicate an organ damage which is going on in a chronic manner. So that is because maybe because of high blood pressure, the kidneys of Bruce are affected. So that could be, there could be some leakage of protein which is causing all these symptoms. So this is an example of high blood pressure, hypertensive case. So what could you do to help Bruce? Basically, you would help him to lower his blood pressure into an optimum manner to control his blood pressure so that you prevent the organ damage, further damage. As you said, ACE inhibitors, drugs which lower blood pressure could be given, etc., etc. Good job, guys. Good, it was a good interaction. So there is a damage happening to organs. That's because of too much pressure, and which has to be considered very seriously, and it has to be treated appropriately. Yes, nitroprusside sodium, Farhan says, it can be given as an infusion. Good job. So you have a simple thing like blood pressure, and everyone knows blood pressure, but a sudden increase in blood pressure could lead to a serious consequence, or very low blood pressure could cause very serious consequences as well. So when would you refer a patient to emergency? You've got three situations here. You've got a patient with blood pressure 180 by 110 or higher, but he has no symptoms. You have a patient who is 180 by 110, and he has symptoms like dizziness, etc., etc. And you have a patient with 220 by 140 with symptoms. In those three situations, what is hypertensive emergency?
220 by 140 with higher symptoms.
Excellent.
Yes, 180 by 110 or higher with symptoms.
Yeah, so yes, that could also be one of the symptoms as well could be one of the factors. And what is the worst symptom? Like, yes, high blood pressure can cause dizziness, but the worst thing which can happen is organ damage. If you have organ damage happening in those situations, you definitely consider that as an emergency case. Okay, so definitely 180 by 110 can be managed with a local doctor in a clinic with medications. You don't have to refer the patient if he has no symptoms straight away to emergency department. If 180 by 110 and the patient has serious symptoms, definitely you refer, and definitely 220 by 140 requires a very immediate referral to the emergency department. The symptoms could range from just feeling dizzy, blurred vision, to organ damage which is happening, which could not manifest immediately, but which could be like, chronic, slow poison, like, in a slow way spreading all over the body, which is like life-threatening. So the third situation is an example of hypertensive emergency, very frequently asked in KAPS. When would you consider it as a hypertensive emergency? A blood pressure of 220 by 140 or higher with symptoms is considered hypertensive emergency. So now I have a question. Is rapid reduction of blood pressure good or bad?
Bad.
Why?
Bad.
It is very dangerous. Ischemia. It may cause ischemia. Cerebral ischemia.
Okay. Good job. Yes. Very good. Yes. Blood pressure, definitely, if that's a hypertensive emergency, you try to reduce the blood pressure, but you don't do it rapidly. Like, you try to do it as slowly as possible. Okay. So, because your body has to get used to it. Okay. You have to give your body some time to recover. And basically, like in a layman language, if you say slow is better, because rapid reduction of blood pressure can have very, 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 very bad consequences compared to hypertension itself. Okay. A patient who's having high blood pressure might not have any issues than if you're rapidly reducing a blood pressure of a patient. Okay. By using therapy or medications. Okay, so you have to do it very slowly because it could be life-threatening event. Good job, Farhan.
Thank you, ma'am.
Very good. So let's see. This is a small boy here. So we started with patient safety, well-being. We've been into thinking about patient. We have seen a patient crying, and we have seen he's not crying. He's filled with tears because of organophosphate poisoning, and we helped him by giving atropine. And we have seen the symptoms of organophosphate poisoning, of muscarinic effects. Don't worry, we'll discuss everything in detail in the next class. And we talked about Bruce, who is a case of hypertension, hypertensive emergency case. This is, okay, 210, 150, still like, almost closer to 220, 140. And he was referred to ED because here you can see the symptoms: blurry vision, nocturia, indicates the organ damage. So depending on the symptoms as well, a strong referral, a quick referral will help in saving the life of the patient and preventing further damage to the patient. So as Farhan said and everyone said, rapid reduction of blood pressure is not good. You would rather, like patient is okay with high blood pressure sometimes rather than rapidly reducing the blood pressure because it could lead to death. Okay, so that's a gist of the case studies of how we should be thinking as pharmacists in our practice and even in cracking exams like KAPS, which is more demanding these days. They expect you to have good knowledge and strong hold on your concepts. So let's think about the body. A human body has forehead, eyes, ears, mouth, chin, shoulder, elbow, hand, waist, knee, toe, hair, eyebrows, nose, teeth, neck, chest, stomach, finger, leg, foot, etc., etc. Okay, so in helping a patient, we think from head to toe comprehensively to give the best treatment. Okay, a doctor thinks from diagnosis perspective and a pharmacist thinks from therapeutic perspective on how to give the best medication, best therapeutic disease management, advise or plan to the patient to help him control his disease in a better way, improve the lifespan of the patient, and which is our first priority. So my baby always listens to a song in Cocomelon which says we all have five senses: hearing, sight, and smell. We all have five senses: touch and taste as well. Okay, so hearing, sight, smell, touch, taste. These are all five senses in our body. And we have a superhero who is called brain. Okay, who is a controlling power, who coordinates, controls, who is the boss, managing all the five senses: skin, smell, sound, taste, touch, sight. When you see something, like when I was in a school, my physics teacher would say that you're seeing something, but you're actually not seeing it. Your brain is analyzing it for you to see, and that happens in a fraction of seconds. Okay, if you're brain dead, then whatever you see, you can't perceive it. It's like you're seeing, but you don't know what it is. Okay, so all your organs function because of brain. Theoretically speaking, like if you have issues with your heart, you have heart transplantations, liver transplantation, lung transplantation, skin transplantation, etc., etc., but you don't have a brain transplantation. Okay, so if all organs are working well, but the brain of a person is dead, he's considered to be dead because that is a major superhero, and if he's dead, everything is dead. Okay, so brain is a major coordinating, communicating center in our body. So if you feel something, okay, through your skin, if you touch a hot object, you are perceiving that hotness not because of your skin, but the signal sent by your brain to your skin. So if you sense some smell, if you hear something, if you see something, if you touch something, so all your five senses work in a proper way because they are in constant coordination and communication with your brain. So in our body, which is beautifully built by a scientist called God, if you believe in him, so we all have different five senses, and we have a superhero who is brain. And if something happens to brain, the coordination, communication is lost. It's like a pilot flies an aircraft, okay, but he's just a driver, but all the control of where he should be going rests in the base camp, where they relay signals to the pilot. Once the connection is lost, the flight sits into crash because the pilot, even though he can see and drive a plane, he doesn't know what to do. So in the same way, brain is a superhero which controls all the senses of a human body. So I'm trying to make everything simple as possible, so that, you know, if someone has a gap in their previous, you know, studying pharmacy 15 years ago and have a gap, they could just refresh their basics. You all are pharmacists, but we just need a basic refresher. And it's always good to start a subject from basics, because basics is what matters. So basic senses, when we have a superhero brain. And what happens in my body is I have receptors, I have control center, which is brain, and I have effectors. Okay, so, and I have got my brain. And what is brain in those three? What is actually brain doing, acting as in my body in those three aspects?
Control center.
So the brain is control center, which coordinates, integrates everything. Yeah. So what is the biggest organ of our body? Skin. Yes. Which is so surprising. Like when my teacher asked me and she told me skin, I was so surprised, but trust, like, it's very amazing how skin is the biggest organ in our body. Okay, we have skin everywhere. Okay, so if you see that skin, there is actually sweat on that skin. If you can see, it's not water, it's sweat. So what's happening there? Why there's a sweat? Why the patient is sweating?
To maintain the body temperature. Excretion of waste products.
Heat emission,
To maintain body temperature, ma'am.
To maintain body temperature. Excellent. Yes, that's the basic thing. He's feeling hot, hard work. Maybe he has done exercise. Homeostasis. Excellent. Shan. Temperature management, temperature regulation. Yes, good job. So why I sweat a lot? Okay, when I exercise a lot, I generate more heat in my body, and to control my body temperature, my body sweats. You know, I'm like, I have perspiration, and sweat kind of cools down your body. Okay, and through sweat, some substances get excreted, like, you know, waste products get excreted from your body, which is also possible. So the biggest organ in our body is skin, and on the top of the skin, what would I have? Which one of the three would I have? Hair, receptors. Yes, receptors. Yes, I agree. So yes, we have receptors on our skin, and we have effectors, okay, who will take the signal from brain and show the action. So basically, if you see this picture, so there is dryness and high temperature in my skin. Okay, like my body temperature went up. Too much body temperature is not good, which is called fever, right? Too low body temperature is also not good. Okay, so what happens is my skin my skin is very dry. If you can see, my body temperature is very low. Very high. I'm sorry. It's very high. And now the signals get sent from my skin to brain, or if you think skin as a basic organ, which has receptors on the top of it. Okay. Okay. And the skin will send signals to my brain that, yes, we need some regulation to control the high body temperature. And as a result, I start sweating. Okay. The sweating happens, and this sweating is, obviously, we are water. We are made of 70% water. And this sweat cools down my body. Okay. So it's a mechanism through which I can control my body temperature. So tell me, what exactly is this scientifically called?
Homeostasis.
Yes, good job. This is called homeostasis. Okay, we'll talk about homeostasis in detail. So my body temperature was high and my brain has sent signals, and then I started sweating, and then my body temperature came down. Was this conscious? Like, did you send message to your brain consciously that I have to sweat, or was it done unconsciously?
Unconsciously.
Unconsciously.
Yeah, unconsciously this happened, isn't it? You can't say, come on, sweat, and you sweat, right? Like, obviously, if you do exercise, you sweat, but you can't say, come on, let's sweat, and then you don't sweat. Okay, it has to happen unconsciously, like it happens. Okay. So definitely it's unconscious. When you say something is unconscious, is it a voluntary thing or involuntary thing?
Involuntary.
Involuntary.
Unconsciously, your body knows what to do, your brain knows what to do, your brain knows how to, maintain your body temperature, and your body knows how to send signals to the brain. Okay, so it's a coordination between your brain and body, which is involuntary, unconscious in nature. And this beautiful mechanism where our body temperature is maintained is an example of homeostasis. What is this skin brain and skin top called? It is called homeostasis. So homeostasis is a mechanism through which our body involuntarily, unconsciously maintains its regulation. Okay. So if my body temperature is high, I sweat and my body temperature becomes low. If my blood pressure is high, then something happens, like some receptors on my blood vessels send signals to my brain, and then my brain sends signals back, causing low blood pressure, like, regulating the blood pressure and blood sugar as well. So basically, the fluid balance, the blood sugar balance, and the body temperature are the three main principles of homeostasis, and these are all involuntary, unconscious in nature. You can't say, hi, hello, my body, please raise my body temperature, or please reduce my body temperature, because it happens involuntarily. You can't say, come on, increase your blood pressure. Come on, Mr. X, please increase your blood pressure. No, you can't. Okay. And that is why medications help you in controlling your blood pressure, because it can be it can be because of unknown reasons. Okay. So some effect on your homeostasis, which is causing increase in blood pressure. Blood sugar, yes, if you eat something, your blood sugar increases, which is a voluntary action, but you can't tell your body to generate new blood glucose, like increase blood glucose levels, or control your blood sugar, control your diabetes. Yes, if you do exercise, you control your diabetes, that is secondary, but temperature, fluid balance, electrolyte balance, blood sugar levels, all these are involuntary actions which are beautifully controlled and coordinated between your brain and body, and this balance mechanism is called homeostasis. Any deviation to this mechanism will cause issues with temperature, fluid regulation, which cause increase or decrease in your blood pressure, which cause increase or decrease in your blood sugar. And when you have prolonged issues going on in your body like this, chronic or acute all of a sudden, it could range from small issues to death, okay, which can be life-threatening. So any disturbance to homeostasis could lead to serious consequences. And that is where we as pharmacists come in and control this mechanism, try to maintain the balance in our body by artificially giving what? I mean, from externally, what we are giving?
Medicines.
Capsules, injections, etc., etc. And we try to control the homeostasis, maintain that internal environment in our body. So if someone's blood pressure is high, we give blood pressure lowering medications. If someone's blood sugar is high, we give blood sugar lowering medications. Okay. So homeostasis, a mechanism of internal environment regulation. And who performs the task of homeostasis?
Brain.
Brain and your body, okay, together. So, and is the process of homeostasis conscious or unconscious?
Unconscious.
Unconscious. Homeostasis is unconscious in nature mostly. So, and the main system, the nervous system, brain is nothing, nervous system is brain and spinal cord. And the main task performed by who performs the homeostasis, if you're talking about the nervous system, is autonomic nervous system. Okay, so autonomic nervous system forms the basic of pharmacology. Okay, for any exam, and which is a nightmare to most of the students, because when we are talking about autonomic nervous system, we are talking about basics. Okay, and someone who doesn't know basics cannot build any concepts. It's like building a building without a good foundation, okay, which will fall anytime. So having a good grip of autonomic nervous system is very essential for pharmacist, because you're dealing with pharmacology, you're dealing with drugs. You have to know how drugs affect your body, how your body affects the drugs, how your body deals with the drugs. You can know that only if you know the basic pharmacology and all the homeostasis, which you're helping a patient achieve the homeostasis by giving medications, by giving a therapy, treatment is nothing but you're dealing with pharmacology, but you're dealing with the basics, which is autonomic nervous system. So autonomic nervous system is of two types: parasympathetic and sympathetic in nature. Okay, so autonomic nervous system controls your homeostasis, your blood pressure, your blood temperature, your blood sugar regulation, etc., your fluid levels. Everything is controlled in the process of homeostasis, which is a very dynamic mechanism which changes from day to day, time to time, and it reacts on how your body reacts. It understands what your body needs and tries to maintain that internal environment, and any disturbance to that internal environment can be an issue for us. So autonomic nervous system is divided into parasympathetic and sympathetic nervous system, which forms the basis of pharmacology for, like, any pharmacist has to have a good grip on this. So autonomic pharmacology is divided into sympathetic and parasympathetic nervous system. So I think this picture has messed up something. So let's talk about autonomic nervous system, the basics. If someone has to have grip on autonomic nervous system, I would always say have grip on commode chair and have grip on lion in the middle of a jungle, very dark. So just imagine if someone, like, if a patient, not a patient, just like you and me, okay? So if a person sits on a commode chair, okay, he's in a resting state, he's relaxing, okay, he's actually meditating, okay, doing yoga exercise, not exercise, sorry, yoga, in a very relaxed state, okay? He's sitting on a commode chair, and then he wants to read a book under the sunlight, okay? So if he's sitting on a commode chair, definitely on a commode chair, you empty your bowel, isn't it? So you sit on a commode chair just to empty your bowel, to excrete everything out of your body, okay, as a feces, as urine, okay? You're in a very relaxed state and you're reading book under the sunlight. So sitting in a commode chair, reading a book under the sunlight, very relaxed state, you are under the influence of parasympathetic nervous system. Okay, always remember, your entire therapy, your entire exams, your entire practice will come from the commode chair. Okay, and if imagine you're in the middle of a jungle, it's very dark, and you see a lion. Okay, you have two options: you either fight with the lion or you fly away from lion, that is, run away from lion. If you see this boy is running away from lion, so you are in the middle of a jungle, it's very dark, you see a lion and you fly away from lion, you're under the influence of sympathetic nervous system. Okay, so autonomic pharmacology, the entire autonomic pharmacology is dependent on two stories. One is sitting on a commode chair, going to toilet, reading a book under the sunlight, and the second one is middle of jungle, very dark, running away from lion. Okay, so when you're sitting on commode chair, you're under the influence of parasympathetic system. When you're running away from lion, you're under the influence of sympathetic system. Because you fight with the lion if you're very courageous, or you fly away from lion, The sympathetic nervous system is called fight or flight. It's associated with fight or flight responses, and these are involuntary in nature. Okay, you don't know how you react with a lion, right? Like you don't know what you do. Can you tell? Like, can you fight or fly away? You don't know. Rest and digest is associated with the parasympathetic nervous system. So rest and digest is associated with parasympathetic, and flight or fight responses are associated with sympathetic nervous system. So if you remember this, you remember everything. So let's talk about how you remember sympathetic and parasympathetic nervous system. So all of you can see this, isn't it?
Yes.
Yes. So just imagine you're sitting on a commode chair. What are you doing? You're emptying your bowel. That means you have diarrhea, okay? Or like, cleaning your bowel. So definitely you're emptying your bowel because you're sitting on a commode chair. That means your digestive system is performing well. The digestive activity increases, okay? Sitting on a commode chair, you're very relaxed, okay? So your lungs don't need more oxygen because you're very relaxed, okay? So that means your lungs are constricted, okay? That is called bronchoconstriction, okay? If you need more oxygen, your lungs dilate, your lungs expand to accommodate more oxygen. So definitely because you're sitting on a commode chair, going to toilet, you're emptying your bowel, so that is increasing your digestive activity. And then because you're very relaxed, you don't need more oxygen, okay? So that means your bronchi constrict, your lungs are in constricted stage. You're very relaxed, okay? And when you sit on the commode chair, all your secretions increase, okay? Your salivation, your lacrimation, because you're on a commode chair, all your secretions increase, okay? So urination, okay, that increases. You're very relaxed, so your heart rate is low, okay? Very relaxed, your heart rate is low. And then because you have to read a book under the sunlight. So when you have to read a book under the strong light, your pupil has to be very small to concentrate on the letters of the book. That small pupil to concentrate on the letters of the book is called meiosis. Okay, so sitting on a commode chair, going to toilet, reading a book under sunlight. To read a book under sunlight, there is a lot of light. So your pupil has to be constricted. Your pupils, your eyes, just imagine your pupils in your eyes, and they have to be very, very small to, very like, if you're reading something, we like bring eyes very small, constrict our eyes in the same way. Like your pupil has to constrict to read a book under the sunlight, which is called meiosis. Okay. And definitely your heart rate is very low because you're very relaxed, and all your secretions increase when you're under the influence of parasympathetic nervous system because you're resting and digesting. Okay, parasympathetic nervous system is called rest and digest. In case of Mr. James, I told you, he was having secretions, he was crying tears. All the secretions in your body increase when you're under the influence of parasympathetic nervous system. And in organophosphate poisoning, you have too much parasympathetic effects, okay? Too much acetylcholine levels in your body. And this is what happened to James, okay? And that is why he was crying excessively. So under the influence of parasympathetic nervous system, you have too much commode chair activity, again, sitting on the commode chair, going to toilet, under the influence of parasympathetic system, urination, salivation, lacrimation. These are all associated with parasympathetic system. When you think about sympathetic nervous system, you think the opposite way. Okay, so you are in the middle of jungle and you see a lion. It's very dark. Okay, when it's very dark, your pupils have to get bigger and bigger, dilate bigger and bigger to accommodate more light. Here you had a lot of light, so your pupil has to constrict, which caused meiosis. Okay, but here you're in the dark jungle. Okay, you need more light, but you don't have light, so your pupils will dilate bigger and bigger to see properly in the middle of jungle, which is called mydriasis. And definitely this is also involuntary in nature. Okay. And you're running. When you're running, you need more oxygen. So to have more oxygen, to accommodate more oxygen, your lungs will relax so that you get more oxygen, which causes bronchodilation. Okay. Because you're running, obviously your heart rate increases. Okay. And when you're running, you need more energy. Okay, definitely. So your body knows what to do. Again, that beautiful mechanism of homeostasis, it will start producing more glucose in your body. Okay, to stimulate your energy levels, to help you run properly. Okay, so under the influence of sympathetic system, you either fight with the lion or you fly away from lion. You need more energy. So to need more energy, your fats will break to give you more glucose. Okay. And when you see a lion, you don't have time to sit and go to toilet. Okay. So no digestive activity happens. Okay. And when you see a lion, you can't have a baby, like, and that is why your uterus relaxes. So for giving birth to a baby, a female's uterus should contract or relax.
Contract.
Yes.
Contract.
And when you see a lion, you don't have time to give birth to a baby, so your uterus relaxes under the influence of sympathetic system. And as I said, the entire autonomic pharmacology is dependent on the Kamo chair. Sitting on the Kamo chair, going to toilet, reading a book under the sunlight, you have digestive activity, increase in digestive activity, you don't need more oxygen, so your bronchoconstriction happens, you salivate, lacrimate, all the secretions in your body, sweating increases. Okay. And you don't have any glucose production because you don't need energy. You're in very relaxed state. And because you have to read a book under sunlight, you have constriction of pupil, which is called meiosis. And the opposite happens with sympathetic system. In the middle of jungle, running away from lion, your pupils dilate, which is called mydriasis. You don't have time to secrete. Okay. You don't have time to have baby. So your and you need more energy because you're running. So more glucose production, metabolic activity increases under the influence of sympathetic system. That is why, you have to do exercise to improve your metabolism, they say. So, and then because you're running away from lion, you need more oxygen to run. So that's how your bronchi relaxes and your heart rate increases because you're running. Okay, so the opposite happens with parasympathetic. So parasympathetic system and sympathetic system have opposite effects to each other. Okay. So one, if is constricting pupil, the other dilates pupil. One stimulates salivation, in that organophosphate case we have seen, and the other will inhibit the salivation. One will constrict the bronchi, the other will relax the bronchi. One will decrease the heart rate, the other will increase the heart rate. One will stimulate the digestive activity, the other will inhibit the digestive activity. One will, okay, we'll talk about the rest later, the bladder and all that in the next class. So this is the basic pharmacology, and parasympathetic and sympathetic systems all act opposite to each other. And our body is about maintaining a balance between these two systems to achieve a beautiful mechanism called homeostasis. Okay, so the entire pharmacology, autonomic pharmacology, if you have to put it in a single plate to digest, rest and digest is parasympathetic system, fight or flight is sympathetic system, and all the control of your body is with this, all the involuntary actions, unconscious control of your blood pressure, your lacrimation, your salivation, your digestion. You can't say, come on, digest to your intestines and they start the process of digestion. No, you can't do that. Your body has to do it in coordination with brain, involuntarily, unconsciously. Okay, so all your involuntary actions are controlled by autonomic nervous system, and it is a balance between parasympathetic and sympathetic system. So that's about today's class. That's the basics. So do you have any doubts? Thank you, guys. Okay, you can start asking doubts. Yes. Yes, Bharat.
Ma'am, in first case, you said that vitals are normal, but M1 and M2 are working. So I think the heart rate and blood pressure must be low in first case.
Bharat, do you know, do you think everything should happen? Like, suppose if you have seen a person, like he might have had a kidney damage, his kidneys are not working, but he's simply sitting and watching TV. Okay, sometimes some symptoms happen, some symptoms don't happen. We are human beings, like we don't go by rules. Okay. So it's like, it's not possible. Like you don't have all symptoms occurring. So definitely you give therapy advice based on symptoms. Okay, but you can't guarantee a symptom. See, in that case, in the first case,
Yes, ma'am.
yeah. Are you talking about James' case?
Yes,
Or-
ma'am.
Yeah, James' case, what happened? I mean, like, what symptoms did you want, which didn't happen? Definitely he had difficulty breathing, okay, which is an example of, you know, what happens, you know, when you're sitting on a commode chair, you're very relaxed. So that is why you don't have to breathe more. That is why you have bronchoconstriction, okay? But too much parasympathetic activity causes bronchoconstriction. That means you can't breathe at all. Anything in excess is not good in life or in subject, okay, or in everywhere. The principle is a balance between everything. So excess of parasympathetic system is poisonous, it's life-threatening. Excess of sympathetic system is also life-threatening. Here, normally, if you're under the proper control of parasympathetic system, you relax, okay? But in this case, too much parasympathetic activity, in Jane's case, caused breathing tightness of chest. That is, he's unable to breathe properly. Obviously, you all know that from this lesson that parasympathetic system causes bronchoconstriction, making breathing difficult. Okay. But too much parasympathetic activity happened because of consumption of organophosphate poisoning. You can't expect all symptoms in a patient. Okay. You treat
Okay.
based on the history and symptoms available, but you don't expect 100% symptoms. Okay. Any other questions? Is there any limit for BP to send the patient to ED, as there is upper limit is 220, 140? So see, it depends on the symptoms as well, Abdul. So you treat the patient, okay? So if you see any symptoms in the patient, he's feeling dizzy, he can't see properly, even at a lower blood pressure compared to 220, and like what happens if you have high blood pressure is your vessels in your eyes burst, you can't see properly, which is dangerous. It needs treatment. So depending on symptoms, you give treatment and advice. So the limit is 220. No, it's not a limit of sending someone, but normally as a part of therapeutic guidelines, which we follow in Australia, according to Australian guidelines, it is considered 220. That range is considered to be hypertensive emergency, which needs immediate referral to emergency department. And definitely, you don't go by books, you go by patient and the symptoms. Any other questions? Okay, good job. All good questions. Very good job, Abdul. Okay. Gait is, it's like, you know, they can't, Karanveer asking what is the meaning of gait. So they can't maintain a balance, you know, unsteadiness is called gait. 90 to 60. Okay. Okay, that's it. Any other doubts, technical doubts? I want all of you to listen to this class once again. And come back tomorrow where we will be dealing with advanced concepts of autonomic nervous system, the receptor theory, and a bit more detail of pharmacology, focusing on KAPS. Okay. Thank you, guys. I'll relieve you for today. Thanks for your time. Okay.
Thank you, ma'am.
Thank you. Thank